Use these simple lab tests to predict if the patient has insulin resistance. Number 1, if your fasting blood sugar is 100 or more, it could be prediabetes and increased risk of insulin resistance. Number 2, hemoglobin A1C. It's a simple test which tells us how much percentage of sugar is attached to the hemoglobin of your red blood cells over the last 90 days. Levels above 5.6% suggest prediabetes or increased risk of insulin resistance. Levels above 6.4% suggest diabetes. The next few tests are done as part of your routine cholesterol panel. They can be used to determine if you have insulin resistance. Number 3, HDL cholesterol. This is your good cholesterol, which is good for your heart. The number should be above 40, though levels between 60 and 100 are considered excellent. Number 4 is triglycerides. These are bad fats that raise the risk of heart disease and insulin resistance. You want this number to be less than 150. Number 5, one of the earliest predictors of insulin resistance, even before your blood sugars start going up, is the ratio of your triglycerides to your HDL. This ratio should be less than 1.1. If it's between 1.1 and 3, you have mild to moderate risk of insulin resistance. If your ratio is more than 3, you have a high risk of insulin resistance, diabetes and heart disease. For example, if your triglycerides are 120 and your HDL cholesterol is 40, your ratio is 3. This puts you at high risk. Number 6 is fasting insulin level. Normally the range is quite wide, 0 to 25, but you want your levels to be below 9. Levels above 9 increase your risk of insulin resistance. Number 7, another useful ratio of your fasting glucose to your fasting insulin. Levels below 4.5 are sensitive and specific for insulin resistance, especially in women with PCOS. And lastly, HOMA-IR. It's a test that I don't routinely use. It uses your fasting glucose and fasting insulin, and levels above 1.9 predict insulin resistance. If you have any questions, please feel free to reach out to me.